John was a 50-year-old accountant who considered himself pretty healthy. He exercised a few times a week, didn't smoke, and tried to keep a balanced diet. But at his last physical, John was surprised when his doctor noted that his cholesterol levels were higher than they should be for his age. She referred him to a preventive cardiologist to get a more thorough evaluation of his cardiac risk factors. Although apprehensive at first, John scheduled an appointment with Dr. Patel, the preventive cardiologist. At John's initial visit, Dr. Patel explained that preventive cardiology focuses on comprehensive screening to detect signs of potential heart disease even in asymptomatic patients. This allows early intervention to reduce future cardiovascular risk. Dr. Patel took time to go over John's family history, lifestyle habits, and prior health records. He was concerned to see that John's father had suffered a heart attack at age 60. He also noted that John's LDL cholesterol, while not extraordinarily elevated, was borderline high when combined with his family history. The good news was that John's blood pressure, weight, and blood glucose were all within the normal range. However, Dr. Patel wanted to get a full picture of John's heart health. He scheduled John for an exercise stress test, carotid ultrasound, and CAC scan to screen for blockages in John's arteries or vessel stiffness that could foreshadow future cardiovascular issues. The test results showed some early signs of plaque buildup and stiffening arteries typical of someone older than John's age. To Dr. Patel, this highlighted that John was likely at increased genetic risk for cardiovascular disease based on his family history. He outlined a plan for John focused on prevention. He started John on a moderate dose of a statin medication to lower his LDL levels and hopefully slow the progression of plaque in his blood vessels. He spent time going over dietary changes as well, recommending John follow a Mediterranean-style diet high in heart-healthy fats and antioxidants. John and Dr. Patel also made a plan for John to gradually increase his exercise regimen to get 150 minutes of moderate activity per week. This comprehensive approach, combining lifestyle changes and medication, could give John the best odds of preventing further cardiac issues down the road. Dr. Patel made sure John understood the importance of maintaining these prevention strategies long-term. He wanted to see John back in 6 months to recheck his cholesterol and do another stress test to monitor his response to the preventive interventions. John left the office feeling empowered rather than frightened by his cardiac risk factors, now that he had a prevention plan in place. Over the next few months, John became vigilant about exercising more, watching his diet, and taking his statin regularly. At times it was difficult to avoid his favorite comfort foods or squeeze in gym sessions after long work days. But he constantly reminded himself that the effort was worth it to optimize his heart health for years to come. At John's 6-month follow-up, Dr. Patel was pleased to see John's cholesterol levels were markedly improved. The repeat stress test also showed less plaque burden and vessel stiffness compared to John's first evaluation. Dr. Patel applauded John for adhering to the prevention strategies and encouraged him to keep it up. He planned to monitor John's progress annually to make any needed treatment adjustments to keep John's cardiovascular risks minimized. John left the appointment feeling grateful that he had not waited until symptoms appeared to see a cardiologist. Thanks to preventive cardiology, he now had the tools to maintain his heart health and avoid becoming another statistic of heart disease. John's experience shows that a prevention-focused approach can successfully help everyday patients control cardiac risks before they escalate into life-altering events.